Have you ever experienced a persistent ache, pressure, or unusual sensation in your lower abdomen or pelvic area and wondered if it is just a normal part of aging or something more serious? Knowing when to take action is key to maintaining your well-being. When it comes to pelvic discomfort, you should seek a specialist if your symptoms are persistent, worsening, accompanied by other concerning signs, or significantly impacting your daily life. It is always better to get a professional opinion to rule out anything serious and to find effective solutions. The why behind seeking specialist care for certain pelvic symptoms is rooted in the complex nature of the pelvic floor and the various conditions that can affect it. Persistent pain that lasts for more than a few weeks, especially if it is sharp, burning, or throbbing, could indicate issues like nerve entrapment, chronic inflammation, or even a pelvic organ prolapse, which is when organs like the bladder or uterus descend from their normal position. Incontinence, whether it is urinary or fecal, is never a normal part of aging and often points to weakness or dysfunction in the pelvic floor muscles or issues with nerve signals. Similarly, difficulty with urination or bowel movements, such as a constant urge, straining, or incomplete emptying, can signal blockages or muscle discoordination. A feeling of heaviness or a bulge in the pelvic area could directly point to a prolapse, and any unexpected bleeding or discharge always warrants immediate medical attention to check for infection or other underlying conditions. These symptoms are flags that the pelvic system might be under strain or experiencing a specific problem that requires targeted medical evaluation. To address these concerns, begin by scheduling an appointment with your primary care physician. Be prepared to clearly describe your symptoms, including when they started, what makes them better or worse, and how they affect your daily activities. Your doctor can perform an initial assessment and then refer you to the appropriate specialist. This might be a urologist for urinary issues, a gynecologist for female reproductive concerns, a colorectal specialist for bowel problems, or a physical therapist specializing in pelvic floor therapy. You can also research local pelvic floor physical therapists directly, as many allow self-referral, offering a conservative and often highly effective first line of treatment. An insider tip is that a qualified pelvic floor physical therapist often possesses unique expertise in assessing muscle function, identifying imbalances, and teaching targeted exercises that can dramatically improve symptoms without medication or surgery. They use specialized techniques, including manual therapy and biofeedback, to help you regain control and strength. These specialists are trained to evaluate the entire core, not just the pelvic floor, recognizing that abdominal, hip, and back muscles all play a role in pelvic health. Taking charge of your pelvic health by recognizing concerning symptoms and promptly consulting a specialist empowers you to receive accurate diagnoses and effective treatments. This proactive approach ensures you can maintain comfort, continue your active lifestyle, and improve your overall quality of life, allowing you to focus on the activities you love without unnecessary discomfort or worry.